Hello, my name is David Robinson. I'm the Director of Education at Bradford Teaching Hospitals NHS Foundation Trust, and I'd like to welcome you to the Trust. If you're a junior doctor new to the Trust, then welcome. If you're a junior doctor who's worked here before, then welcome back. This is your induction video. We would normally deliver this face-to-face, but due to current restrictions we are delivering as much of our induction as we can remotely. So I'm going to go through the PowerPoint presentation for you now. It is a shortened version of the induction presentation. I do intend to go through it reasonably quickly, so feel free to pause on any slides if you want to read some of the more detailed slides at your own leisure. If you have any queries at the end of the presentation, then please do contact myself or the education team and we'll try and answer your queries.
So I'm going to talk about our educational services here in Bradford and who's here to support you. I'm also going to talk about briefly some clinical information, some serious incidents that have happened in the Trust and what we can learn from them. I'll also talk about education and clinical supervision and your pastoral support. In terms of induction, you may well have all completed the HEE passport induction. You'll have been sent information about this separately. This is your Trust induction. For new FY1 doctors, there is a clinical skills part of the induction where you get a chance to refresh some vital clinical skills. For other doctors who want to refresh your clinical skills, this is not mandatory, but we can provide clinical skills training if you want, so please contact us. As well as this Trust induction, you should receive a local induction in your specialty area. You will also have been sent details of mandatory e-learning, which you need to complete as soon as possible if you haven't done so already. So within the Medical Education Department, I am the Director of Education. We also have a simulation training lead who is Dr. Liz Jones, a consultant in paediatric emergency medicine. Our technical skills lead is Mr. Mal Gandhi, orthopaedic consultant. For foundation trainees, we have foundation training program directors who oversee your training, provide support to you, and will conduct your ARCP. For FY1 doctors, your FTPDs are Shafi Khan, a consultant in emergency medicine, and Naeem Jagirdar, consultant radiologist. For FY2 trainees, your FTPDs are Alistair Jones, consultant in emergency medicine, and Nada Sabir, consultant in obstetrics and gynecology. We also have a network of college tutors within most specialties, and within the education team within Field House, we have a postgraduate medical education lead who is Lisa Shaw. Lisa Shaw is also our point of contact for you as doctors in training. So you may well receive emails from Lisa Shaw at some point in the next few months. These emails may be important, so please read them. Within our education centre, we're fortunate to have excellent education facilities. We're one of the very few trusts in the Yorkshire and Humber region to have co-located technical skills lab and simulation centre. Within the technical skills lab, we have a mix of high fidelity and low fidelity equipment for you to come and experience and develop your technical skills. There are drop-in sessions available if you want to come and just develop the skills in your own time on your own. And of course, we also organise formal courses. Details of these courses are on our BEAT website, or your educational supervisor or college tutor may well have details of courses that are relevant to you. Alternatively, you can contact us within education and we can provide details of courses in our technical skills lab. Also within Fieldhouse, we have our simulation centre. Within the simulation centre, there is a resuscitation area and also a separate ward area where we can simulate ward patients and ward rounds. Very briefly going to talk about the Trust's core values, to provide the highest quality healthcare at all times, and one of the visions of the Trust is to be an outstanding provider of education. I think it's important to recognise that we're proud of our teaching hospital status. but Bradford is a teaching hospital with a large DGH feel. And by that I mean that often people will stop in the corridor to have a conversation. People know who other people are, unlike some other large teaching hospitals where you sometimes feel like a cog within a wheel, and we don't have that personal touch. I think Bradford's a little bit different. So in terms of raising concerns, you may well at some point have concerns about the quality of your training or the standards of care within your workplace, and sometimes those things are intertwined. If you do have concerns, then the important thing is that you raise those concerns and escalate appropriately. There are a number of avenues where you may want to raise your concerns. For training concerns, then please discuss with your educational or clinical supervisor. And you could also discuss with your college tutor or foundation training program director if you are a foundation trainee. If you're not getting the response you require, then please let us know within education, and please contact me directly if you're not getting the response or if you have very significant concerns. It's important at this stage that I inform you that our guardian of safe working hours is Dr. Andrew Brennan, who is a consultant anaesthetist. Sometimes there are incidents or complaints and things don't go quite the way we plan them to. The important thing when that happens is that we act in an open and transparent way. So please make sure you document things accurately and that you escalate within your team when things go wrong. I'm now going to move on to serious incidents and some important learning which applies to us all, but also to you as doctors in training. Before I go on to talk about serious incidents, many of you as doctors in training will be required to be involved in quality improvement activities and may be required to complete a quality improvement project or QIP. So we do have a quality improvement team here in Bradford Teaching Hospitals NHS Foundation Trust who can support you in your QIP if required. So they can be involved in planning your QIP, making sure it's appropriately structured, that you're involving the right people, and they could even help with data collection and supporting you in writing your report. So contact details for our quality improvement team are on this slide. And if you're going to be involved in quality improvement activities, I recommend that you contact our quality improvement team. In terms of learning from SIs, one of the recurring themes is poor management of the deteriorating patient and often poor recognition of the deteriorating patient. So news scoring plays a key role in recognising the patients who are deteriorating, and it's important that we're all aware of the news algorithm. So patients may be escalated to you as a doctor in training, and it's important that you know which patients you should be escalating beyond yourselves. So please make sure you're aware of the news algorithm. Several years ago now, there was a run of patients within this trust, penicillin allergic patients who were given penicillin in error. And therefore the trust has put in place several actions to try and minimise the risk of this recurring. And it's important that you're aware of these. Clearly it's important to check a patient's allergy status before prescribing medication. When you are prescribing, please try to avoid interruptions so you are focused on the task appropriately. Please try to avoid interrupting nursing staff when they're performing their medicine rounds so they can concentrate on that important task. It is everyone's responsibility to check a patient's allergy status, including senior medical staff. And where an allergy status is in question, please make sure you're using other sources to confirm a patient's allergy status, whether this is EPR or a patient's GP record, System 1. We do have penicillin allergy posters in most clinical areas and often posted on drug cupboards, and these will guide you as to which drugs never to prescribe in patients with a penicillin allergy. Those you could prescribe with caution, particularly cephalosporins, and those antibiotics that are considered safe. We have anaphylaxis kits and hypoglycemia boxes in many clinical areas, and these boxes will contain the essential drugs to treat both anaphylaxis and hypoglycemia. Anaphylaxis kits are kept on every crash trolley in the trust, and please find out in your local area where the hypoglycemia box is stored. In terms of infection prevention and details of patients with a history of MRSA, C. diff or other multi-resistant organisms, this information is recorded on the ICE system using the infection alert, which you can see on the screen. Other infection prevention alerts are also found in the patient's electronic patient record. Another recurring theme from serious incidents, and particularly with deteriorating patients, is lack of recognition or effective management of sepsis. So I hope you're all aware of the sepsis 6. The key message is for patients who are deteriorating on a ward to think about sepsis as a possible cause, and where you're suspecting sepsis, to please commence the sepsis bundle in a timely fashion. For antibiotic prescribing, there is clear guidance available on the Trust intranet. So look up the antibiotic guide. It contains really useful information about which antibiotics to use in certain conditions. It contains dosing information and also recommendations of antibiotics to use in patients with penicillin allergy. Also be aware that you can discuss cases with consultant microbiologists if there are any doubts or concerns. VTE assessment is mandatory on admission to hospital, so please make sure these assessments are conducted and that any VTE prophylaxis is prescribed if required. And finally, with regard to serious incidents, if you are involved in an incident or complaint, particularly if it's the first time you've been involved in this, then it can be a distressing and worrying time. So please seek support from your clinical or educational supervisor. Within education, we will also provide support if required, and the risk management team, who sometimes will investigate incidents or serious incidents, can also provide support to you. It's important to guide you on reflections and reflective practice. This is a key part of our development as health professionals. But if you are involved in an incident or complaint, you should make a reflective note and add this to your portfolio. It's important to be aware that a reflection should not contain patient identifiable information. It should simply capture the learning outcomes and any future plans for you as a doctor in training. In terms of the GMC, they will not ask doctors to provide reflective notes if they are investigating concerns. But doctors can choose to offer them as evidence of insight into their practice. Reflective notes can be required by a court, and therefore they should focus on learning rather than the full discussion of the case. I would really recommend that you ask your supervisor to review any reflective note that you make in response to an incident or complaint before you upload the reflection to your portfolio. Most clinical areas will have a dedicated time for handover at the beginning and end of each shift. Many people find the SBAR format useful for formal handover and also for communication such as patient referrals. Please make sure that handovers and referrals, there's adequate documentation in a patient's record around that. And for areas that are still using paper handover sheets, please make sure that these are destroyed in confidential waste bins. Please do not take them home, as we have had incidents of handover sheets being found by members of the public, which clearly is a concern, an information governance breach. And in terms of patients' discharge, prior to discharge, please make sure that investigations have been chased up locally and acted upon if required. And please make sure that your documentation discharge contains relevant information, particularly for our colleagues in primary care. I'm now going to briefly talk about your day-to-day clinical supervision in your clinical practice. So there will always be a senior doctor responsible for overseeing your practice. They may or may not be actually within the clinical area at that time, but there at least should be someone available for advice on the phone. It's very important that you as a doctor in training work within your limitations and be aware of your limitations and when you're exceeding them. There are maybe times at work where you need to escalate patients who are deteriorating, or again, when you're aware of patients and you are being asked to work with it beyond your limitations. So where you are escalating, important thing I think is to be appropriately assertive, to communicate clearly, and again using SBAR, this clear SBAR format can be useful. And I would recommend that after you've escalated patients, if you have the time, that you document your escalation and who you've escalated the patient to, and the details of that conversation and any actions as a result of that conversation. In terms of working within your limitations and support at work, if you have concerns that you're not being supported adequately in the workplace, or you're not receiving the response that you require when you're escalating concerns, please share that with us in education, because we would be very keen to hear about that. We want you to be supported, and if you're not receiving the support you require, please let us know so that we can investigate and provide support. There may be times as a doctor in training that you are supervising others during procedures, or you are being supervised. So the guidance here on the slide is to how to make sure that is done safely. I'm not going to go through that in any further detail. You can read the information on the slide. There is a concept of delegated consent where practitioners who are not going to carry out a particular procedure can gain consent from patients. You need to be aware of the nature of the condition, the type and complexity of the treatment, the risks and benefits of the treatment. We have a list of conditions where delegated consent is appropriate for FY1 doctors and FY2 doctors. This slide details the list of procedures where an FY1 can take consent, and this slide details the list of procedures where FY2s can take consent. To consent beyond these lists is a breach of the trust consent policy. You must refuse to do it as a doctor in training, and you should not be pressured to do it. If this is happening, please let Lisa Shaw in education know directly, and we will investigate this further. So, with regard to your educational support, you should have an allocated educational and clinical supervisor, and their responsibility is to provide mentoring and support to you while you're here in Bradford Teaching Hospitals NHS Foundation Trust. They may also give you career guidance as you progress. Bullying and harassment is not tolerated within this trust, and if you experience or witness that, please escalate to your supervisor or to your foundation training program director, college tutor, or to myself. In terms of further support, and this is more around your health, so if you're aware that there are any issues with your health, either physical or mental, then please seek support. That's the most important thing. And there are various avenues for support. HEE run a counselling service called Take Time that you can self-refer to. Within this trust we have a workplace health and wellbeing centre. Again, you can self-refer there, and you can receive support through that avenue. The Workplace Health and Wellbeing Centre also incorporates our occupational health service. You may also want to contact your GP if you have any concerns about your health. The important thing is to seek support if you need it. Established doctors in training will be aware of the normal supervision structures and scheduled meetings. This may be new for new FY1 doctors, so you should be organising your initial meeting with your supervisor as soon as possible. This is where you'll meet your supervisor and review your background and aspirations, agree educational objectives for your post here, and discuss and agree a personal development plan. Depending on the length of your placement, you may or may not have a midpoint review, but you will all have a final review with your supervisor at the end of your placement, where you review objectives and achievement of your objectives, review portfolio evidence, and compile a final educational supervisor's report. We have a network of associate college tutors within this trust. So these are doctors in training who support local college tutors, are involved in educational work, and also act as junior doctor representatives on the Junior Doctor Forum. So if you have an interest in education or you want to be involved in the Junior Doctor Forum, I really would encourage you to express an interest in becoming an associate college tutor. You can contact Lisa Shaw within Education, who will take this forward for you. I'm taking the opportunity now just to share information about working well at night and working safely on night shifts. So the Royal College of Anaesthetists has published this useful guidance. Please take a minute to have a look at that. The Trust does have short notice rest facilities available for you post nights, if you're feeling very tired and feel that you can't get home safely, for example. Information on how to access short notice rest facilities is available in your induction information. And with regard to use of social media, please make sure that you're being sensible in your use of social media. With regard to posting information, please respect confidentiality, so don't post patient identifiable information on social media. And really, with regard to your workplace, particularly, I would caution against being critical of your workplace or colleagues on social media, as you could end up in hot water. And finally, I'm just really keen for you to make it a success while you're here in Bradford. I want you to enjoy the learning experience and to get the most out of it. Please behave professionally. You're a really important part of the team. Please respect your colleagues around you, and I would expect that they respect you. Please work professionally with your multi-professional colleagues. As I mentioned earlier, I'm really keen for you to be involved in quality improvement activity while you're here in the Trust, and use the sources of support available to you from the quality improvement team. And finally, for you to be aware that we do run a Trainee of the Month award, which is a multi-professional award. But we're always really keen to have nominations for doctors in training. So please, nominate your colleagues as doctors in training. Information is circulated on our weekly Education Global email about the Trainee of the Month award. We're really keen to celebrate success. So please do nominate colleagues if you feel they're worthy of the Trainee of the Month award.
So thank you for watching the induction presentation. Really do hope you have a fantastic time working here at Bradford Teaching Hospital NHS Foundation Trust. In education, we are here to support you. So if you have any queries or any problems, please do not hesitate to contact us.